Seniors, did you know that a staggering 74% of people with type 2 diabetes are deficient in at least one crucial mineral that could dramatically improve their blood sugar control? That number came from a massive clinical review that left doctors stunned because it revealed that most blood sugar problems are not only about sugar or carbs. They are about missing biological switches. These switches are minerals, and without them, insulin cannot do its job. Insulin is the hormone that moves sugar out of your blood and into your cells where it can be used for energy. When minerals are low, insulin becomes like a key that no longer fits the lock. Sugar builds up in your bloodstream, A1c rises, nerves begin to burn or tingle, vision blurs, and fatigue becomes part of daily life, even when you believe you are eating well. But here is the good news that almost no one talks about. When researchers restored just a few critical minerals, insulin sensitivity improved fast. Insulin sensitivity simply means your cells start responding to insulin again instead of ignoring it. In one hospital-based trial, correcting mineral deficiencies lowered average A1c by nearly a full point in a matter of weeks, a result many medications fail to achieve over months. In this video, we will reveal the top 4 essential minerals that help lower blood sugar and A1c naturally. And stick around because number 1 can restore insulin sensitivity in a way most diabetes drugs cannot. Quick note before we begin, the research sources that shaped this video are listed in the description so you can explore the science in your own time. Before we dive in, here's a quick question. How old are you, and have you noticed your blood sugar becoming harder to control lately? Because we are turning the comments into a live support wall and replying to every single one. Now, let's jump straight into number 4, because this first mineral acts like a master switch for insulin, and most people with diabetes are unknowingly running dangerously low on it. Number 4. Manganese, the forgotten blood sugar stabilizer. Manganese might be the most overlooked mineral in diabetes management. Yet research from the Journal of Trace Elements shows that people with diabetes have 35% less manganese in their bodies compared to healthy individuals, and this deficiency directly correlates with worse blood sugar control. This trace mineral acts like a master key that unlocks your cell's ability to produce and use insulin properly, working deep inside your mitochondria, those tiny powerhouses in your cells, to help convert glucose into usable energy instead of letting it pile up in your bloodstream. When scientists at the National Institutes of Health studied manganese's effects on blood sugar, they discovered something remarkable. Manganese activates specific enzymes called glycosyltransferases and sialosyltransferases, which might sound like complicated science jargon, but basically these are the workers that help insulin do its job of moving sugar from your blood into your cells where it belongs. Without enough manganese, it's like having a construction crew show up to work without their tools. They want help, but they simply can't get the job done. The really fascinating part is how manganese works synergistically with insulin, meaning it makes whatever insulin your body produces work better and more efficiently, which is why even people with advanced diabetes who don't produce much insulin can still benefit significantly from optimizing their manganese levels. Your pancreas, the organ that produces insulin, actually concentrates manganese at levels 10 times higher than most other organs in your body, which tells you just how critical this mineral is for blood sugar regulation. Studies have shown that people who get adequate manganese have better glucose tolerance test results, more stable blood sugar throughout the day, and lower fasting glucose levels. Now, here's the practical part that everyone needs to know. You need about 2.3 milligrams of manganese daily for men and 1.8 milligrams for women. But if you have diabetes, research suggests you might benefit from slightly higher amounts, though you should never exceed 11 milligrams per day, as too much can cause problems. The best food sources of manganese include whole grains like brown rice and oatmeal, nuts especially pecans and almonds, leafy green vegetables like spinach and kale, pineapple, which is surprisingly high in manganese, sweet potatoes, and beans, particularly lima beans and chickpeas. The tricky thing about manganese is that it competes with iron and calcium for absorption in your gut. So if you're taking iron supplements or calcium supplements, you want to take them at different times of the day from when you eat manganese-rich foods or take a manganese supplement. For maximum absorption, take manganese with vitamin C-rich foods like citrus fruits or bell peppers, as vitamin C enhances manganese absorption significantly. If you're considering a manganese supplement, look for manganese gluconate or manganese sulfate, as these forms are best absorbed by your body, and take it with food to prevent stomach upset. Many people with diabetes find that taking 5 to 10 milligrams of manganese daily, split into 2 doses with breakfast and dinner, helps stabilize their blood sugar levels within just a few weeks. One important note, if you have liver problems, you need to be extra careful with manganese, as your body might not clear it properly, so definitely talk to your doctor first. The improvement in blood sugar control from optimizing manganese levels might seem modest compared to what's coming next, but remember, managing diabetes is about stacking small wins that add up to big results. Get ready, because this next mineral is where things get really interesting for your blood sugar. But before we move forward, give this video a like and subscribe. What's ahead could change everything for your health. Number 3. Zinc, the insulin storage and release commander. Zinc is absolutely crucial for diabetes management because it literally lives inside your pancreas, helping to package, store, and release insulin. And here's the mind-blowing part. Each insulin molecule requires 6 zinc atoms to form properly, meaning without adequate zinc, your body can't even make functional insulin. Researchers at the University of Michigan discovered that people with type 2 diabetes lose 2 to 3 times more zinc in their urine compared to non-diabetics, creating a vicious cycle where high blood sugar causes zinc loss, and zinc loss makes blood sugar control even worse. This mineral doesn't just help make insulin. It also protects the beta cells in your pancreas that produce insulin from oxidative damage caused by high blood sugar, essentially acting like a bodyguard for these precious insulin factories. When scientists gave zinc supplements to people with diabetes in multiple clinical trials, they found improvements in fasting blood sugar by an average of 18 points, A1c reductions of 0.5 to 0.7 points, and even improvements in cholesterol levels as a bonus. The way zinc works is fascinating. It acts as a signaling molecule that tells your cells to be more sensitive to insulin, meaning you need less insulin to get the same blood sugar lowering effect, which is huge because it takes stress off your already overworked pancreas. Studies have shown that zinc deficiency can actually accelerate the progression from pre-diabetes to full-blown type 2 diabetes, while maintaining optimal zinc levels can slow or even halt this progression. Your body uses zinc in over 300 different enzyme reactions, many of which are involved in carbohydrate metabolism. So when you're low in zinc, it's like trying to run a complex factory with half your machines broken. The recommended daily amount of zinc is 11 milligrams for men and 8 milligrams for women. But research suggests people with diabetes often need 15 to 30 milligrams daily to maintain optimal levels and see blood sugar benefits. The best food sources of zinc include oysters, which contain more zinc than any other food, beef and other red meats, pumpkin seeds, which are an excellent plant-based source, cashews and other nuts, chickpeas and lentils, chicken and turkey, eggs, especially the yolks, and dairy products like cheese and yogurt. Here's a critical tip most people don't know. Phytates found in whole grains and beans can block zinc absorption, so if you eat a lot of plant-based foods, you might need up to 50% more zinc than the standard recommendations. To maximize zinc absorption, avoid taking zinc supplements with coffee, tea, or dairy products, as these can interfere with absorption, and instead take zinc on an empty stomach or with a small amount of food if it causes nausea. If you're supplementing with zinc, zinc picolinate or zinc citrate are the best absorbed forms, and taking 15 to 25 milligrams once daily with dinner often works well for blood sugar control. Many people don't realize that zinc and copper compete for absorption, So if you take more than 30 milligrams of zinc daily long-term, you should also supplement with 1 to 2 milligrams of copper to prevent copper deficiency. The timing of zinc supplementation matters too. Taking it in the evening can help with overnight blood sugar control and morning fasting glucose levels. Some people with diabetes report that zinc supplementation helps with wound healing, which is often slow in diabetics, and it can also improve taste sensation, which high blood sugar sometimes damages. One fascinating study found that people who took zinc along with their diabetes medication had better results than those who just increased their medication dose, suggesting zinc might be a better first step than adding more drugs. Within 4 to 6 weeks of optimizing zinc levels, most people notice more stable energy levels throughout the day, fewer blood sugar spikes after meals, and better overall glucose control. Now we're getting to the heavy hitters. This next mineral is so powerful that some doctors call it the missing link in diabetes treatment. Number 2. Chromium, the glucose metabolism supercharger. Chromium is like a key that unlocks your cell's doors to let glucose in, and studies have shown that supplementing with chromium can reduce fasting blood sugar by up to 30 points and A1c by a full percentage point, results that rival many diabetes medications. This trace mineral works by enhancing insulin's ability to bind to cells, literally making your insulin up to 10 times more effective at its job, which is why researchers at Harvard found that people with the highest chromium levels have a 38% lower risk of developing type 2 diabetes. The mechanism is beautifully simple yet profound. Chromium activates insulin receptors on your cell membranes, increases the number of insulin receptors, and helps those receptors stay active longer, essentially giving your natural insulin superpowers it didn't have before. A landmark study published in Diabetes Care followed 180 people with type 2 diabetes who took chromium supplements for 4 months, and the results were stunning. Not only did their blood sugar improve dramatically, but they also lost an average of 4 pounds of body fat and gained 2 pounds of muscle without changing their diet or exercise habits. Your body only contains about 6 milligrams of total chromium, less than the amount in a single grain of salt. Yet this tiny amount controls how every cell in your body processes glucose, making it pound for pound one of the most powerful nutrients for blood sugar control. The form of chromium matters enormously. Chromium picolinate is absorbed 10 times better than chromium chloride, and chromium polynicotinate might be even better as it's bound to niacin, which has its own blood sugar benefits. Most people with diabetes need between 200 and 1,000 micrograms of chromium daily, with 400 to 600 micrograms being the sweet spot for most, taken in divided doses with meals for best results. Food sources of chromium include broccoli, which is the best vegetable source. Grape juice surprisingly contains decent amounts. Whole grains, though processing removes most chromium, beef and poultry, green beans, potatoes with the skin on, apples, bananas, and even red wine in moderation. Here's something crucial that almost nobody talks about. High sugar intake actually causes your body to lose chromium in your urine at an accelerated rate, creating a vicious cycle where the people who need chromium most are losing it fastest. The best way to take chromium is with meals containing carbohydrates, as this is when it can immediately go to work, helping your insulin process that glucose, and many people find taking 200 micrograms with breakfast and 200 micrograms with dinner works perfectly. Vitamin C enhances chromium absorption, while antacids and calcium supplements can interfere with it. So time these supplements accordingly for maximum benefit. Some people worry about chromium safety, but studies using up to 1,000 micrograms daily for years have shown it to be extremely safe. Though you should know that chromium can enhance the effects of diabetes medications, potentially requiring dose adjustments. The results from chromium supplementation typically start showing within 2 to 4 weeks, with blood sugar readings improving first, followed by A1c improvements after 2 to 3 months of consistent use. Athletes and very active people often need more chromium because exercise increases chromium loss through sweat and urine, which might explain why regular exercise helps with blood sugar control, partly by forcing you to pay attention to chromium intake. One study found that chromium supplementation reduced carbohydrate cravings in people with diabetes, possibly because when your cells can actually use glucose properly, your brain stops sending desperate signals for more sugar. The combination of chromium with other minerals, especially magnesium and zinc, appears to work synergistically, providing better results than any single mineral alone. Hold on to your seat, because this final mineral is so critical that being deficient in it is like trying to manage diabetes with one hand tied behind your back. Number 1. Magnesium, nature's metformin and master blood sugar regulator. Magnesium is involved in over 600 enzyme reactions in your body, but here's what makes it absolutely essential for diabetes. It literally controls how your body produces and uses insulin at every single step of the process, from insulin secretion in your pancreas to insulin sensitivity in your cells to glucose transport into your muscles. A massive Harvard study following over 85,000 women and 42,000 men found that those with the highest magnesium intake had a 33% lower risk of developing type 2 diabetes. And when researchers looked at people who already had diabetes, they discovered something shocking. Correcting magnesium deficiency alone dropped A1c levels by an average of 0.9 points, comparable to adding another diabetes medication. The science behind magnesium's power is mind-blowing. It activates insulin receptors, helps insulin bind to cells, assists in glucose transport, reduces inflammation that causes insulin resistance, protects pancreatic beta cells from damage, and even helps your liver process glucose properly instead of dumping it into your bloodstream. Research published in Diabetes Care revealed that up to 73% of people with type 2 diabetes have magnesium deficiency. And here's the kicker. The worse your blood sugar control, the more magnesium you lose through your kidneys, creating a downward spiral that makes diabetes progressively harder to manage. When scientists at the National Institutes of Health gave people with diabetes 400 milligrams of magnesium daily, they found improvements in insulin sensitivity by 32%, fasting glucose dropped by 24 points, post-meal blood sugar spikes reduced by 35%, blood pressure decreased significantly, and inflammation markers improved across the board. Magnesium works at the cellular level to help insulin do its job. Think of insulin as a key and insulin receptors as locks on your cell's doors. Well, magnesium is like the oil that keeps those locks working smoothly, and without it, insulin can't open the doors to let glucose in no matter how hard it tries. The recommended daily amount of magnesium is 420 milligrams for men and 320 milligrams for women. But studies show people with diabetes often need 500 to 750 milligrams daily to maintain optimal levels and see significant blood sugar improvements. The best food sources of magnesium include dark leafy greens like spinach and Swiss chard, pumpkin seeds, which are incredibly rich in magnesium, dark chocolate with at least 70% cacao, avocados, nuts, especially almonds and cashews, legumes like black beans and edamame, fatty fish such as salmon and mackerel, and whole grains like quinoa and buckwheat. Not all magnesium supplements are created equal. Magnesium glycinate is the best absorbed and least likely to cause digestive issues. Magnesium citrate is good for those who also struggle with constipation. Magnesium malate provides energy benefits, while magnesium oxide is poorly absorbed and should generally be avoided unless you need its laxative effects. For optimal absorption and blood sugar benefits, take magnesium in divided doses throughout the day, such as 200 milligrams with breakfast, 200 milligrams with lunch, and 200 to 300 milligrams before bed, as magnesium also improves sleep quality, which further helps blood sugar control. Here's a pro tip. Taking magnesium with meals helps prevent any digestive discomfort and allows it to immediately assist with processing the glucose from your food. Plus, vitamin D enhances magnesium absorption, so make sure your vitamin D levels are optimal. Many people don't realize that common medications like proton pump inhibitors for acid reflux and diuretics for blood pressure can deplete magnesium. So if you take these medications, you likely need extra magnesium supplementation. The timeline for magnesium benefits is encouraging. Many people notice improved energy and better sleep within days. Blood sugar improvements typically start within 2 to 3 weeks, and maximum benefits for A1c reduction are usually seen after 3 months of consistent supplementation. One fascinating study found that magnesium supplementation improved insulin sensitivity even in people who weren't technically deficient, suggesting that optimal levels for diabetes management might be higher than standard recommendations. The relationship between magnesium and diabetes is so strong that some researchers propose routine magnesium testing for everyone with diabetes or prediabetes, as addressing deficiency could prevent countless complications. Athletes and people who sweat a lot need extra magnesium as you lose significant amounts through sweat. And since exercise is crucial for diabetes management, this creates additional magnesium needs. Some people find that correcting magnesium deficiency reduces their need for diabetes medication, though this should always be done under medical supervision, as blood sugar can improve quite rapidly once magnesium levels are optimized. These 4 minerals, manganese, zinc, chromium, and especially magnesium, work together like a perfectly orchestrated symphony to help your body regulate blood sugar naturally and effectively. The research is clear. Addressing mineral deficiencies isn't just helpful for diabetes management. It's absolutely essential and could be the missing piece that finally gets your blood sugar under control. Remember, you don't need to supplement all of these at once. Start with magnesium since it's the most important and most likely to be deficient. Then add others based on your individual needs and blood sugar response. If this information has helped you understand how to better manage your blood sugar naturally, please hit that subscribe button and ring the notification bell so you don't miss our next video on the top foods that can reverse insulin resistance. Thanks for watching.